Hi, I'm Dr. Gary Clayman of the Clayman Thyroid Cancer Center of Tampa, Florida. In this video, we're going to talk about what are the benefits of removing just part of my thyroid gland.
Dr. Clayman, thank you for I've been given the diagnosis of a thyroid cancer. I have a papillary thyroid cancer on my left side of my thyroid. I've been told, and I hear that there's opportunities for me to get like all of my thyroid removed at surgery or half of my thyroid removed at surgery. So this video, I want you to tell me what are the opportunities to get only half of my thyroid removed? Are there pros and cons? What's good about only taking out half my thyroid? Am I still going to get cured? Is it okay for me to do that? What's the deal?
Jim, it's a great question. And so what's important is that, number one, your thyroid cancer is cured. And number two, that you have the right treatment for you and for your thyroid cancer.
So everybody can't have just half the thyroid removed. So how do you know who gets half of it removed?
Well, it has to do with the relationship that you have with your surgeon and your endocrinologist. That's part of it. So everyone needs to feel comfortable with the extent, how much surgery that is being proposed to effectively treat your thyroid cancer. Because let's think about the advantages of removal of just half of the thyroid gland. If I remove half of your thyroid gland, you may require still a thyroid hormone, but you still have some component, some aspect of your thyroid that remains that is also going to be producing these small little proteins that the thyroid produces that control your basic metabolism, how much weight you gain, the thickness of your hair, all the sort of intricate things that the thyroid hormone controls.
So I think I get what you're saying, that I have to have thyroid hormone in my body so I can get thyroid hormone through a pill every day, or I get thyroid hormone like I do now through my thyroid. If you take out half of my thyroid for my thyroid cancer, then I might not need to have a thyroid pill, or I still might need to have a thyroid pill. But if I need a thyroid pill, it would be a smaller thyroid pill because I still have part of my thyroid.
It's just adding to what your thyroid is already producing. And then the other thing is when we give you a thyroid pill after we've removed all of your thyroid gland, it is replacing everything that the thyroid is producing.
Because my entire thyroid's gone, so all the thyroid hormone in my body, I have to get through a pill.
Right. Most patients will feel very well just taking a simple pill if you remove all of their thyroid gland. But a small number of patients will just not feel right again after you've removed all their thyroid gland and they're just taking the pill.
So I guess the advantage is then that some people will actually feel better if they have some of their own hormone as opposed to just hormone out of a bottle of a pill.
Exactly.
But okay, so I get that. There's advantages to hormones in some people, but can I be cured if I've got thyroid cancer? Don't need to take the entire thyroid out. You can still cure me by just taking out half my thyroid?
Absolutely.
Everybody, or just some people?
Just some people. So I want to show you this, okay? So this here is your thyroid gland.
Right.
Okay?
Like a butterfly thing.
That butterfly thing there. And most thyroid cancers occur within this gland. So they're within the whole substance here. And they're covered by natural, normal thyroid tissue. So they're within the substance of the thyroid. So if I just remove half of your thyroid gland and I remove all of the cancer that was within the thyroid gland, then that will cure you. Now, sometimes there are little lymph nodes that lie underneath the thyroid gland, and underneath here along the breathing tube, and behind here is a swallowing tube. When we remove half of the thyroid gland for thyroid cancer, I will look at those lymph nodes during your surgery, and I will have the expert doctors called pathologists that look at those lymph nodes tell me while you're asleep whether there's cancer in those lymph nodes or not. If the cancer has been completely removed in the thyroid gland and is not present in any lymph nodes, there's no reason to remove your whole thyroid.
So I think this comes off, right?
Yeah.
So if the thyroid cancer's here, you can take this off and save this part.
Right.
Okay, and then it could benefit me by it's making some hormones, so it could help make me feel better. But during the operation, if you find any lymph nodes that have cancer in them, if there's cancer in those lymph nodes, then you have to take the entire thing out. Then all bets are off. You can't do just half the thyroid. You have to do all of it.
And that's the important discussion. When I'm talking to my patients before the surgery, I tell them, I'm going to talk to you more than I'm going to take doing your surgery. And the reality of it is that if I've found cancer in the lymph nodes, the right surgery is to remove the whole thyroid gland. And we just do it at that time.
Got it. So obviously it follows then that I need a surgeon who actually gets it, who needs to be able to find those lymph nodes and get them tested. And these are decisions that are made in the operating room, but they're made by a surgeon who does this stuff all the time.
You're asleep, you have one surgery, and everything is handled at that time. In this video, we talked about the advantages of removal of just half of the thyroid for thyroid cancer. In the next video, let's talk about what are the disadvantages of removal of just half of the thyroid for thyroid cancer.